Hi, this is Dr. Mehtab. In this video, we will discuss about disaster management cycle. It is divided into three stages: disaster phase, and post disaster phase. Mitigation and preparedness come under pre disaster phase. Disaster response and relief operations come under disaster phase, and rehabilitation and reconstruction come under post disaster phase. In mitigation, we do hazard and vulnerability assessment. Structural and non structural measures are taken. In preparedness, we prepare emergency plans, then warning and evacuation, and consolidate preparations for next disasters. In response and relief operations, we carry out the search and rescue operations. We provide food, water, shelter, sanitation, clothes, medical and trauma care to the patient. It may last, it is a short term. Response activities are taken out for short term duration. Rehabilitation include restoration of basic services and functions. It may last for weeks to months. Then reconstruction involve full resumption of services plus preventive measures. It may last for months to years. Then we will discuss one by one. Mitigation are the measures taken prior to the impact of disaster to minimize its effects. Structural measures include national building codes, zoning and land use management. Non-structural measures include policies and procedures to raise public awareness regarding vulnerabilities. Preventive measures to reduce impact. Next is preparedness. Formulation of viable emergency plans, development of warning systems, maintenance of inventories, public awareness and education and training of the personnel. Search and rescue measures as well as evacuation plans for areas that may be at risk from a recurring disaster. So first we will identify the area which is prone to disasters, then we will make a plan to evacuate them. These are the cyclone resistant shelter homes in Odisha, which were designed by IIT Kharagpur. Uh, like 10 lakh people were evacuated were evacuated to the shelter homes in Cyclone Fani in these shelter homes. A response include setting up control rooms. Response comes under disaster phase. It includes setting up control rooms. Like even in COVID, we have COVID control rooms. So similar to that, we will set up the control room for that particular disaster, putting the contingency plan in action, issue warning, action for evacuation, taking people to safer areas, rendering medical aid to the need, simultaneously rendering relief to the homeless, food, drinking water, and clothing. Search and rescue operations shift injured person to health facilities. Bed availability and surgical services should be maximized. In this phase, then victims' identification should be prioritized. Adequate mortuary space should be provided. Then triage. It is done in mass emergencies. There are two types of triage: simple triage and reverse triage. First, we will discuss about the simple triage. It is done in mass emergencies. Injured persons are classified based on the severity and likelihood of survival. It should be carried out at the site of disaster. High priority to be given to those patients where immediate and long term prognosis can be affected by simple intensive care. And lowest priority is given to the patients, like moribund patients with questionable benefit. Phases of triage: pre hospital triage or field triage, triage at scene by first clinician attending the patient, and triage on arrival to emergency department or receiving hospital. Color coding system for triage: red color indicates high priority treatment or transfer, yellow medium priority, green are ambulatory patients, black include dead or moribund patients. The name, age, place of origin, triage category, diagnosis, and initial treatment of the patient should be tagged to them. Patients with chest wounds, shock, open fractures, 2 to 3 months come under immediate category with a color coding of red. Patients with a stable abdominal wound, eye and CNS injuries come under delayed category with a color code of yellow. Then patients with minor burns or minor fractures or minor bleeding Come under minimal category, these are ambulatory patients with a color coding of green, and patients who are unresponsive with high spinal cord injury, like their chances of survival are minimum. They are with a color code of black. Then reverse triage. Reverse triage is done in military settings and mass casualties in emergency department. Patients with less severe injuries are treated first and discharged. It facilitates to relocate hospital resources on critically ill patients. Identification and care of dead. The removal of the dead from disaster scene, then they are shifted to the mortuary, and they should be identified, and reception of bereaved relatives. Relief operations are undertaken during and immediately following a disaster. Immediate relief measures include search and rescue operation, damage needs assessment, debris clearance. Then four principal components in managing humanitarian supply in relief operations are: first of all, we have to acquisition of supplies, then transportation, their storage and distribution. These are the relief operation. This picture is taken from Kedarnath floods, where NDRF and military were combinedly doing the relief operations. Then rehabilitation, provision of temporary public utilities and housing as interim measures to assist long-term recovery, facilitate a revival of economic activities, focuses on enabling affected populations to resume more or less normal patterns of life. These are the earthquake-proof houses in Kutch. These houses are called Bunga houses, which can withstand the earthquake. Like after Bhuj earthquake, these were designed by an NGO in Kutch area. Kutch is more prone for Kutch district in Gujarat is more prone for earthquake. So these kind of houses were built to withstand the earthquake. Reconstruction. Permanent reconstruction or replacement of severely damaged physical structures. Restoration of all services and local infrastructure include revitalization of the economy, including agriculture. And, these reconstruction processes are integrated into long-term development plans, taking account of future disasters. Okay, in the next video, we will discuss about the institutional framework of disaster management in India.